Yeah, so this is similar to the E7820 in a patient population that has relapsed refractory disease where there's really no clear standard of therapy. And this is a combination of the histone deacetylase inhibitor Entinostat with a PD-1 inhibitor Pembrolizumab. And this was a multi-center phase 1b trial that has completely accrued with, I think, 28 patients on this as protocol. And this was in primarily MDS patients. There were 25 MDS patients and 3 AML patients, if I'm not mistaken. And what we could see here, there were a few responses in terms of marrow complete remissions, but those were also transient. There were no complete remissions. There were no partial remissions. There was some limited efficacy signal, and we're presenting the data here. The rationale for this trial was also the idea that myeloid-derived suppressor cells mediate resistance to checkpoint inhibitors, and entinostat and other HDAC inhibitors could potentially suppress the myeloid-derived suppressor cells and then restore sensitivity to checkpoint inhibitors. The correlative studies are still in process, so I don't have the data on this yet. But in terms of clinical efficacy, there was limited efficacy. Safety was as expected in this heavily pretreated, older patient population, primarily myelosuppressive events, but limited immune checkpoint related adverse events as well.